decision, what after NEET PG with Dr. Rohit Jacob today. So I know the NEET PG exam just ended, and a lot of us are in confusion about what career paths to take and what are the right ways to go about what suits us more than anything else. So I'm glad that you all are here. Before I begin, so today we have with us Dr. Rohit Jacob, who's MD in medicine, and apart from being a doctor, he's quite jack of all trades. So he's a YouTuber too, and he's a motivational speaker, and we'll be sharing all his links with you after the session. So good evening, Mr. Hood. Welcome to the session. Sir?
Hello.
So I welcome you to the session.
Yeah. Can you see me?
I hope my team members will be able to tell you that better.
Yeah, we can.
Yeah, I think, yeah.
Okay. So before sir begins, I'd like to give a short introduction about DFC for everyone here who's joining us for the first time. So Doctors for a Cause. Doctors for a Cause, we're a non-governmental organization. We started out as a group of medical students just wanting to do something better for the society with the leftover money we had after a fest. And now it has gone to become a nationwide pan-India organization with both online and offline work happening. So Doctors for a Cause operates under the domain of 6 task forces. 8 task forces. These task forces include things from animal welfare to differently abled people, LGBTQIA, academics and education, and so many more. So you would like to, if you wish to get to know more, you can always go on to our social channels and see for yourself. And we are opening our recruitment, so if you wish to join us, you can always join and contribute from your place. A little about some of the current projects DFC is doing. So currently we have something known as Proficiency, which is actually a WhatsApp based teaching initiative for all those interested. So what we have is essentially a schedule. We have people from different specialties that are often taught in medicine to us in our colleges, but not always we get a good hold on these subjects, right? So Proficiency is our academics task forces initiative to make it easy for everyone to get acquainted with medicine and maybe just revise those topics or learn them well by postgraduate doctors who are available to you there and then in the group. So we have a schedule too. We've already had sessions on jugular venous pressure and also an ophthalmology session, something on ulcers too, I believe. So this is something that's happening. If you wish to be a part of this and participate in these revisions, all you have to do is become a member. And becoming a member, there's a small group which you can join, and from there you'll be given the instructions. Otherwise, the link is on our Instagram bio and you can always go from there. Another thing, we have also Indian Sign Language sessions, lessons on DFC Instagram stories. So if you wish to learn a new language that doesn't need words, you can always check our socials. So everything happens by that. Now I'd like to continue with the session. Today, Dilemma to Decision, we will be starting with Sir's introduction and whatever Sir has to say. So Sir, over to you. I hope the session is beneficial for all.
Right. Thank you, Arushi. Thank you so much for giving that brief intro. So Doctors for a Cause, as she said, it's a great initiative which is started by young students who are not only just focused towards studying or towards the medical curriculum, but also in creating a difference in the society. So to start with, first and foremost, Arushi, can you just share my screen?
Yes, sir.
Yeah. Right. I hope you can see the screen.
Yes, it's visible.
Right. Okay. So NEET PG 2021, which has been a boon for many, a disaster for more than many. So it has become a big problem for each and every one of us because we are unable to decide as to what to do next. The NEET PG 2021 has been a dilemma for all of us. So it is high time that we decide how to arrive from a dilemma to a particular decision.
Trying to find the link.
So, so first of all,
I'd request the participants to keep their mics muted until after that, because we'll have a Q&A session where you can clarify all your doubts. As of now, sir, over to you.
yeah. So first and foremost, it's important to know that this video is not for all toppers who drop even after getting JIPMER and want to take AIMS. So this is not meant for such toppers. This video is meant for majority of the students who believe that they need just a seat. Okay, so most important thing that we should know is that patience is the key, right? Patience is the key to achieving something big. After about 1.8 years of preparation, it has been a disappointment for many as to getting a satisfying mark or a satisfying rank and not able to decide as to what to do ahead in life. एक तो majority of us have waited like 1.8 years, and then apart from the interns who were preparing for a year, majority were repeaters who, I would say that the proportion between fresh interns and repeaters who scored bad was more among the repeaters than the fresh batch. That's probably because the repeaters were actually frustrated in the last 4 months of seeing the exam getting postponed again and again and again. So how to move ahead in life is, first thing is that we need to be practical, and then we need to make our choice. So to start with, we need to know what other questions we need to ask. First and foremost, would you get your desired field? Second, government or private? Third, MD or DNB? Now, getting your desired field is possible only if you make a particular choice as to what should be the field you want. It's important to realize that every branch is equally important. It's not like a person who takes anatomy is not equal to the person who takes surgery, medicine, or gynec, because each branch has a future, and each branch has a future in a different way. The only thing we need to realize is how to get successful by taking that particular branch. But yes, the most important thing is that we need to like that particular branch. Okay, so every branch is important. These are all 19 subjects which we have studied throughout our 5.5 years of MBBS. And finally, we come to a conclusion as to what is our favorite, right? So seeing those books, don't get panicked. We don't need to study all of them after your NEET PG. It is only till you crack your NEET PG. Like I would say, I have not read Bailey or OBS or ENT or Ophthalm, anything after NEET PG. In fact, all of these books also I have not read. It's more just of the study review which I've read. So I didn't want to put the study review picture. Otherwise, people will think that I've just read study reviews and passed the exam, right? Okay. So the next thing to important to know is deciding your particular branch, right? So first of all, prioritize to your top 3 choices. Okay. It's important that you prioritize your top 3 choices because it is among them that you're going to choose. Throughout our 5 years of MBBS, some of us are able to understand which field or which branch we need to choose. Some of us, majority of us, still don't know what is good for us. Okay, so it is very important to decide your branch. I would say, do not decide on the basis of your internship. Decide on the basis of what you like to read during your PG life, during your UG life. So especially when you enter OT, when you enter the operation theater, if you like wearing the gown, if you like standing for hours together, and if you like using the scalpel, opening up and coming out and then telling the patient that yes, the surgery is successful, if you like that kind of thing, then go for a surgical branch. And if you like a kind of field where you like sitting in the OP, you like talking to the patient, and you like discussing their problems and clearing them out, giving them a particular treatment and monitoring them over a period of time, then go for medical branches. There are a select few who like something called, discussing family problems, personal problems. So that is one of the very flourishing field which is happening today, which I guess you all would know, that is psychiatry. So there are so many fields like that. Apart from that, there are non-clinical fields like anatomy, physiology, pathology, pharmacology, microbiology, biochemistry. All these fields are equally good. Remember, the person who is teaching you for NEET PG would have also thought in a similar way, like the way you are thinking right now. Okay, so when that person has thought about all this and still chosen a non-clinical branch, and you, every medical student knows that teacher's name who's teaching that non-clinical branch, is itself a mark of success. Whether it is Professor K. Krishna Kumar, whether it is professors like, I don't remember their names also right now. So yeah, many of them. So all of them are equally good, and all of, like Gobind Rai Garg, all of them are equally good and very successful in their fields, even though they chose something like a non-clinical branch. Okay, so it is important to prioritize to your top three choices. When I gave my NEET PG, I had prioritized into top three as pediatrics, medicine, and pharmacology. Trust me, my third choice was a non-clinical field. That was only because I believed that even being a pharmacology person, I can get into research, I can still teach, I can still practice, and there are so many things that I can do. So when you prioritize to your top three choices, then only you can arrive to a conclusion. So this is the strategy which I feel everyone should follow. Okay, let's say you are not getting a government seat. Okay, the next step which I feel you should do is opt for DNB or take a good private. Both of these are interchangeable. Of course, many would say that privates are not affordable for us. Agreed. I agree to that completely. So in that case, you should learn to opt for DNB. MD and DNB both are considered equal. So please do not think that DNB is inferior to MD. So I will be coming to that in my next slide. So taking a good private or opting for DNB is always a good choice. Next step would be opt for your second or third preference, which you have prioritized in your list. And finally, last, if you're not interested in all of these, then only I would say to take a year drop. It is not about the time that you're giving in preparing. It is about how much motivation and encouragement you have in achieving that particular thing. Trust me, there are students who have scored rank of 10,000 and 12,000 who say that this time my score was less or my rank was less. So I should take a drop one more year. Next year, probably I will score a rank of 2,000. It's important that you learn to be practical. It's important that you decide when to take a drop and when not to take a drop. Okay. Now, next slide is MD versus DNB. It's important to understand that DNB belongs to the NBE board, that is Diplomate of National Board. When you do an MD field or a DNB field, both are considered equal in the market. Okay, there, like for example, I would say that currently where I'm working, like as a consultant physician, a parallel to me is a colleague of mine who has done DNB medicine. And both of us have nearly equal number of patients. Both of us are treated equally. It is only about the years of experience which is differentiated between MD and DNB. That's it. That's the only thing. Now, it's important that there are few advantages of taking a DNB. Number one is that there is less fees in comparison to an MD private. Okay. So if you opt for an MD private, it is important that you choose a good college, right? So it is not like you can choose any kind of private which has your branch. Never do that. Choose a good private where you will learn your skill, because finally what matters is not whether you did from government, whether you did from private, or whether you did DNB. What matters is how much skill you've gained, how much well versed are you with the subject, and how well you can converse with your patient. So these are the three things which are primarily important. So whether you do MD, DNB does not matter. So these skills need to be developed. So less fees in comparison to an MD private. Now I'll just give you an example of mine, that when I finished my MBBS, during my internship itself, I was preparing, but that preparation maybe wasn't sufficient enough. So my first try itself, my rank was 40,000. Okay, I never scored beyond 40,000, and that was probably the second year of NEET PG. Okay, so before that there was CET. So NEET PG came, and it was it was the second year. So during my internship, my rank was about nearly 39,000. So after attempting during my internship, I decided to take 1 year drop. So I decided to take a year drop because I knew with my internship I was not able to prepare to my fullest. So I took 1 year drop. I went to a place called Kanchipuram, which is like in the interior of Tamil Nadu, and I went there and I was just studying there. Right. So about 10 to 12 months I was just preparing, and then my rank came up to 14,000. But one thing I knew, that once I gave the exam, I realized that I did not do well in the exam. but I was not willing to give one more year drop because I knew that probably I might not get a score better than this, and especially because I wanted pediatrics or medicine. So the options which were left for me was choosing an MD private or going for DNB. Of course, DNB was my first preference more than an MD private, but because that was the first year where MD and DNB was selected on the basis of the NEET PG rank. That was the first year. So I was not able to decide whether I would get a DNB medicine or pediatrics in the counseling itself. So that is why when it was found that I could not rely on it completely, I went for an MD private. So this is how it was done. The next thing which I need to tell you is that in a DNB course, you get extremely good theoretical knowledge, because to pass a DNB is way difficult than to pass an MD. To get an MD is way difficult than to get a DNB. This is how the system is. The entry in MD is difficult. The entry in DNB is easy. Passing out of MD is easy, and passing out of DNB is difficult. Why is it difficult? Because you need extremely sound theoretical knowledge to excel in the DNB exam. Moreover, DNB final exam is more centralized. So let's say you're doing DNB from Maharashtra, but your exam center will be in Kolkata. So this kind of thing is there, and it will be difficult for you to even converse with your patients. So that is why passing a DNB practical exam is also difficult. But when you pass out from DNB, the level of confidence that you have in yourself is to another level. So DNB, I would say that you shouldn't think twice before choosing a DNB if you get your selected field. Right. Now, post DNB also, if you're trying to prepare for your super specialty entrance, DNB super specialty or DM super specialty, both can be given by a DNB passed out candidate. So there is no differentiation in that. Right. MD and DNB earn the same salary and they are taken of the same preference. And every hospital that employs an MD doctor or a DNB doctor only sees where he has passed out from or how much skill he has. Let me give you an example. A famous hospital in Mumbai, Wokhard Hospital. Okay, so this hospital had two employees. So one of my friend works in Wokhard itself. So that's how I came to know about this. So in Wokhard, there was the CEO who was employing doctors. Okay, physician post. One was an MD candidate, right? And another was an MD candidate from a private, and another one was an MD candidate from GMC Aurangabad. Okay. Now, what happened was when he took the interview of both, he asked similar questions and both were able to answer. But when he chose the MD private over MD GMC Aurangabad. And when he chose that, he put that person for 3 months probation period where he would see how the doctor performs in the hospital, whether he's able to get patients, whether he's able to converse with the patients well. And after that, he would decide whether to continue him or not. So that's what I'm trying to say. When you join a particular hospital after passing out, the only thing that matters is your skill. It does not matter whether you're from government, whether you're from private, whether you're DNB. That's none of their concern. Yes, I agree in one thing, that if you do MD medicine from a central institute or any top government institute, you get a direct walk-in entry. But that is the only difference which happens in the initial phase. After that, everyone is treated equal. So there are few important tips that you need to know. That you need to choose a college that helps you gain your skill better, irrespective of government or private. Do not hesitate to take DNB and do not compromise on the field of your choice. Let me tell you, if you have to choose between your field and between your college, always choose your field. Always choose your field. Because for the next 40 to 50 years of your life, you have to live with that particular field. You don't have to live with your college. Right. So this is the major difference that everyone should know. One of my juniors, he had called me and he told me that, sir, in mid-year INI CET, he got AIMS pharmacology. But he was very much interested in medicine and he was not interested in doing a non-clinical branch. So he was confused whether to drop it or not because he got AIMS Delhi. So in such a situation, he took the bold step of dropping that and going ahead and preparing for medicine. Right. It does not matter what rank he got next. What matters is that he went behind the field he wanted. Right. So this is the most important thing that you should know. Now, these are few last year cutoffs for DNB, which I have just collected all together and kept. Now, remember, these cutoffs are all after the third round of counseling, right? So if dermatology is there, the rank was 6,700. This is all approximate range, maybe 6,712, 6,720, something like that. So that rank was the last to get a dermat seat in DNB. Dermatology is a very lucrative branch, which is chosen by many people who like the physician side. But only thing is, to get a dermatology seat is very difficult in government and in private. To get in private also, your rank should be like within 5,000. Okay, so any rank which comes up in the third round of counseling is like your jackpot, is like a luck. Okay, so what I would say is, when you apply for counseling, the first round of counseling is your best hope. After that is all depending on your luck, right? So next one is radiology. Of course, radiology, everyone knows it's a lucrative branch, but now it started getting saturated, probably because every person is a radiologist. Then nuclear medicine, general medicine. General medicine, as I said, DNB last year cutoff, the final rank which got is 18,000. Now remember this, that all these ranks that I've mentioned, these are the last ranks which have got into her private hospital for DNB. So that means that that hospital may not be very good. Okay, so that is something which you need to remember. Getting a DNB seat is not like you can choose any private hospital you get. You have to choose among the ones which give you good knowledge. Because as you know, DNB is done in a private hospital, right? It is not done in a medical college. So the difference already lies there. Especially if it is a surgical branch, it's important that you get cutting. In a medicine branch, it is as good as, your head physician seeing the patient and you seeing the patient. You will get to learn from your physician, but academics should be strong in that particular hospital. Pulmonary medicine. Pulmonary medicine is another lucrative branch which has taken a big step ahead, probably because of the COVID pandemic, right? So people have started getting to know what is pulmonary medicine, and so pulmonary medicine have started getting a big break in the society. It was not as before, because everyone used to consult primarily a general medicine. So the job of a general medicine has got split between general medicine and pulmonary medicine. Of course, when you choose pulmonary medicine, remember that you will only be looking at the chest aspect throughout your life. You will never be going to something abdomen, neuro, cardio, nothing. It will always be lungs, right? So that is something which you need to decide whether you want to go for it or not. Next, pediatrics, orthopedics, surgery. General surgery, of course, it's another good branch, but only thing is, you need to move ahead to do a super specialty, because then only you will achieve a mark in the society, right? As a general surgeon, to practice in the society, you need to be experienced, you need to be getting a big break, and so on and so forth. OBGY, as usual, it's always lucrative because delivery is usually done by them. A nuclear medicine or general medicine usually doesn't take that risk. Then going on with next, ophthalmology. Ophthalm is another very good field, I would say. Why I'm saying ophthalm is very good? It's because post your MS ophthalm, the next step that you have is 1 year fellowship or maximum 2 year fellowship. The moment you do a fellowship in any part of the eye, whether it is cornea, whether it is retina, whether it is vitreous humor, or anything of that sort, ophthalm is one of the very lucrative fields which will make you established in the market. Now, when you look at all these fields, remember that don't go behind money. I have seen that many students ask only one question: what is the scope of a particular field? Scope is a very broad term. Don't go behind how much money you will earn. I will tell you that majority of the anatomists and pharmacologists earn more than a general physician. Okay, so that is something which you need to know. Every field is lucrative, and every field, how you develop in it or how you become successful in it is in your hands. It's not in the field or the college hands. So that is something you need to know. Right. Next is ENT. Of course, you need to have very good skill to become an ENT surgeon. So it's important that you get a very good cutting in whichever hospital you chose to do ENT. Then comes anesthesia. I would say anesthesia is one of the most risky branches, which, especially for the patient, because anesthesia takes a lot of initiative in the OT, but unfortunately, they do not get that much credit as much as what they do. Okay, so anesthesia is something which is like, handling critical patients all the time. And it always gives you a thrill every day that you went and saved this patient, every day you went and saved this kind of patient. So anesthesia is a very thrilling field. But only thing is that you won't have your separate OPD like a general medicine or a pulmonary medicine or a pediatrics or an orthopedics. Anesthesia is like the backstage people who have worked very hard to save the life of a patient. Okay, so that is the thing which you need to know about anesthesia. But the good thing about anesthesia is that nowadays people have started taking fellowship in critical care after doing anesthesia. So that has helped them to, broaden their experience and move towards something called as managing critical care or managing intensive care in the ICU. So I have seen that many private hospitals, corporate hospitals have anesthetists who are leading the intensive care department, and they are equally good. It is not like people see, yeah, he's a general medicine, then he has done critical care, so he's a big person. No, what they see is how much experience he has in intensive care, how many patients he has brought out of the ICU after being on a ventilator. So these are the things which matter the most, right? Next, family medicine, radiotherapy. Let me tell you, this is something which is a very big controversy, because what happens is many students who have had ranks above 30,000, 40,000, 50,000, they think that why to take a year drop, I will take something like family medicine or radiotherapy or nuclear medicine or hematology and transfusion medicine. Remember, take a field which is known rather than taking a field which is unknown, because what happens is you really don't know what is the step next after doing something like a family medicine or hematology and transfusion medicine, because many corporate hospitals or any private hospital will not have something like, yes, vacancy for family medicine or vacancy for nuclear medicine, vacancy for radiotherapist, vacancy for hematology transfusion medicine. This never happens, because what they usually want is someone who can handle all their patients. Right. So as a family medicine, yes, I would say you can handle your own OPD, you can set up your own clinic, you can manage patients. It's not like you won't get your skill, but of course, prefer known fields more than unknown fields. That means commonly with students take which fields they take, opt for those fields rather than those which are not opted for. Okay. Next, pathology. Of course, pathology is a very good field because first and foremost, you have many options. After pathology itself, there are so many fellowships and, like for example, hematology, hemato-oncology. So a pathologist plays a big role in the diagnosis of a particular disease, right? So every field contributes to the diagnosis of the disease. It's all about how much you are thrilled to practice that particular field. Apart from that, a pathologist can also teach. A pathologist can there are many pathologists who have done hemato-oncology and do bone marrow techniques, bone marrow aspiration, biopsy, and they practice also. So there are so many ways of achieving your field where you want, right? Next one is emergency medicine. This is a very upcoming field because DNB emergency medicine has taken a big step in managing the casualty. Now, when a patient comes to a particular hospital, the first person he sees is emergency medicine, right? And emergency medicine is, if you do it from a good hospital, you will be as skilled to do an ultrasound, to do an echo, to do all the interventions like central line, arterial line, intubation, and so on and so forth. So emergency medicine is again a lucrative field, and most importantly, it is very thrilling because you're continuously trying to save the life of a patient. Right. Now, coming to the 6-year courses of DNB, that is neurosurgery, pediatric surgery, and plastic surgery. Now, these 3 6-year courses, it's important that you choose a very good hospital in doing these. Because remember, when you're entering this hospital, you're entering as a just passed out MBBS. But by the time you come out of this 6-year course, you are finally a neurosurgeon or a pediatric surgeon or a plastic surgeon, which is a big name to carry forward. Okay, so which is such a big name to carry forward, because now when you enter the field, the next step is you are dealing with brain hematoma and you have to take the patient to OT and operate. So this 6 years, you should become a master in your field. It is not like general surgery where you have another 3 years to experiment, another 3 years to practice, another 3 years to learn your skill. A complete 6 years of neurosurgery, pediatric surgery, or plastic surgery, you have to choose from a good hospital. So these are the primary fields, and I would say that among these fields, any or every field is equally important. So finally, there are small final boosters that take a branch that you won't regret later. Second, choose a seat in your own area for easy communication. Remember that if a person who is studying in Kerala or Tamil Nadu goes to UP or Bihar, it will be very difficult to converse with the patient. Okay, unless you converse nicely, you cannot get your skill. So preferably take something which is in your own state or somewhere where you know the language at least. A person studying in extreme north in Delhi, I'll tell you the best college in India is, apart from the Central Institute, comes GMC Trivandrum, okay, which is in Kerala. That is the best college in Kerala. But a person in Delhi who is not getting a Central Institute should not opt for GMC Trivandrum just because it's a very good college, because it will be a disaster for him the moment he joins. Right. So what is important is that you choose a college in your own state. It could be like VMMC, or it could be Hindurao, it could be Gangaram, DNB, anything of that sort. But all of them will give him good skill. At the same time, it will make him more comfortable in practicing his own state. Remember that the worst thing that can happen to a student is taking a seat and leaving it after 3 to 6 months. That is the worst thing which can happen, because there are students who call up and say that I have taken this field, and after 6 months I'm like, I don't want to practice this field, I'll take 1 year drop and prepare. This is not something which you can try and leave it, right? 1 year is going to cost you a lot. Okay, so it's important that you take a wise decision in choosing one particular field, right? One more thing which you need to remember is that if you take a DNB seat and you leave it in between, next 3 years you cannot attempt DNB. Okay, this is an important thing which one should know, that for DNB, I repeat again, that if you take a DNB seat and then you drop it in between, for next 3 years, you cannot attempt DNB. Okay, so you need to make a very good choice as to what field you want to practice later. The final and the most important tip which I need to tell everyone is, do not drop a year because you scored less. Drop a year only if you feel you didn't give your best. Sometimes when you prepare, you have problems like family problems, you have something like financial problems, or you may have relationship problems. So all this does not help you focus. Okay, if in your next drop you are able to say that I can overcome this and completely concentrate on my studies itself, then go for a drop. Okay, because that is the most important choice you need to make. Be practical in making a choice. Now I'll give you my example. When I scored a rank of 14,000, I realized that to get an MD medicine or pediatrics in government, I should have an all India rank of at least 3,000. To get a state rank of at least 300, then only I can get. So if I take a year drop, then also, and I give my best also, there are still chances that I may not get medicine or pediatrics. Okay, so you need to be practical enough to make a choice in such a way that you won't regret it later. You are choosing your own branch, and you will be able to practice it and gain maximum skill out of it. So these are few tips which I wanted to tell everyone. So finally, I hope it was helpful for each and every one of you all. And if you have any queries, you can ask me right now.
Thank you so much for the amazing talk, sir. I think it cleared a lot of aspects about the future after NEET PG, because a lot of us are not aware of it. And the communication part, I can actually personally relate to it, because I'm from Delhi and I'm studying in Chennai. So communication, knowing the language becomes a really key factor. And I think with postgraduate, it is even more important, because that is the time we actually learn and polish our skills in the specific branch. So now the floor is open for questions. Anyone who wishes to ask sir a question can just raise their hand and ask. We'll distribute the mic one by one.
Yeah, or you can put it in the chat box itself.
You can put it in the chat box as well. So you can take a screenshot of the frame if you wish to contact sir beyond the session, and then we can move on to the session. The floor is open for questions, guys. Yes. Any information on taking PLAB and USMLE, sir?
Right. Okay. So let me tell you, it depends on what you're doing right now. Let's say you're doing your internship, or you just finished your internship, or you're doing MBBS for that matter. Taking PLAB or USMLE, remember, it's going to cost you 2 to 3 years. Okay, at least 2 to 3 years in clearing all the steps. developing your own profile or the biodata, as we call it, doing some research publications, and so on and so forth. It is not something which, is impossible to achieve. Remember, PLAB and USMLE are, frankly, I would say, is much easier to achieve than NEET PG. Okay, it only depends on where you want to reach. If your aim is in migrating the country, migrating from India, then go for PLAB or USMLE. And if your aim is achieving a better standard of life, go for USMLE. If your thought is that I won't be able to do NEET PG, I think I'll be able to do USMLE, then don't go for it. Okay, go only if your dream is in that particular place, right? Now, with the upcoming pattern, the good thing is that with the upcoming pattern of next USMLE, PLAB, all will have similar kind of questions. In fact, I think the current NEET PG also is giving up similar kind of questions itself. So it becomes easier to, prepare for all three exams, and you can give all the three. But, it is always better that focus on one and learn to aim and achieve for one. Right. So PLAB, as you know, it has got 2 steps, and USMLE, as we know, it's at step 1, step 2 CS, and step 2 CK. So after clearing USMLE itself, you have to apply to nearly 150 to 200 colleges and then wait for one particular college to respond. Right. So there are multiple factors which play a role after clearing all 3 steps. Apart from that, doing electives during your internship, let me tell you, it is not something which is compulsory. Of course, it builds your profile, but even if you don't do it and get very high scores in your step 1, step 2, uh, MCQ based steps, then also it is going to help you a lot, right? So that is something which you need to remember. Right. So next question, 1 minute. Yeah, what if we do MRCP? Right. MRCP, as you know, is member of Royal College of Physicians. Now, MRCP is open for all people who have even finished their MBBS. It is not like you have to finish your MD to do MRCP. You can finish your MBBS and still do MRCP. MRCP is a very bold step and it's a very good step. But only thing is that the pass rate is low compared to international students. The major cause is it is very, very clinical. So a person who has done 3 years of MD, especially in a clinical branch like medicine or pulmonary medicine, then only he will be able to answer those level of questions. Of course, you can start preparing at the same time, simultaneously work, and still it will be of good help. Another advantage of doing MRCP is that it is valid in many countries like Canada, Australia. In fact, to practice in Australia, you just need MRCP part 1. You don't need anything more than that. Okay, for Canada, you need MRCP. In India itself, if you are MD medicine and you have an additional MRCP, it creates a big bonus. Okay, because it is something which has become a new trend in India. All physicians have started, preparing for MRCP or preparing for DM. Like in my case also, I am thinking of planning to prepare for MRCP. So MRCP is a very good step and it's a very good decision to take.
Next question.
Okay, which DNB Institute for Medicine can we join and which can we avoid to go? Right. So I will not tell you which we can avoid to go because that is a very personal thing which varies from one person to the other. But there are many colleges which you should go, starting from Delhi. There is Gangaram, there is Hindu Rao, there is VMMC. Then apart from that, there is, wait, I'll tell you, I made a big list of DNB. Right. So there is, yeah, so there is a lot of places in Delhi, like Max Hospital, then Safdarjung Hospital, Hindu Rao, Gangaram. Then if you go to south, there is KIMS Secunderabad, there is Durgabai Deshmukh Hospital in Hyderabad, there's Apollo Hyderabad, there's Saint Teresa Hospital, Care Hospital, Sunshine Hospital. There are so many. Now, I'll tell you, there are some hospitals which are common for medicine, pediatrics, and all clinical fields. One of them is like Kokilaben, then Gangaram Delhi, then St. Stephen's, there is Ambedkar, there's Batra Hospital, there's Hindura Hospital, Deen Dayal Hospital. Then for pediatrics, especially, there is Chacha Nehru Bal Vidyalaya. Like that, there are many hospitals which are commonly taken for DNB. Now, the best way to find out whether a hospital is good or not is directly call the hospital and ask them to connect you to a particular resident, because this is the best way you can get an opinion. If you ask a personal opinion from one to one, it will vary. It has to vary, and that will create bigger confusion. So this is the best way to find out which hospital is good or not. And how to choose whether it is good or not is see the number of patients, then see the academics, then see how much independence you get to practice, and how much procedures you get to do. So these are the important things which you need to ask when you look for a DNB hospital.
Next question is the next exam and its effect on FMG.
Right. Okay. So next exam, as you know, is coming up from 2023. We have one more NEET chance, that is 2022. So next exam is, I think, a very good step by the government, where you have something called as part 1 and part 2, where you finish your internship and where you finish your final year MBBS and you give your next part 1, right? So it takes more than just doing MBBS to become a doctor. This is what the next has introduced. So you finish your MBBS final year, you give next part 1. This next part 1 has got MCQs, which are clinical as well as theoretical, and you have to score a good score in next part 1, because that is going to help you score, that is going to help you determine your rank for your postgraduate entrance. Okay, that is your next part 1. Once you do that, you have 1 year internship that makes you eligible for internship. You do the internship, then you give next part 2. In next part 2, you just have to clear it or you just have to pass it. But that does not play a role in the selection of your PG. Only next part 1 plays a big role, because that mark is going to help you get your PG entrance. Coming to FMG, the FMG is about to be scrapped, and even students who are studying in Russia, Ukraine, or Philippines, or anywhere, all these students have to give next exam, and then only they can appear for PG. So it is an advantage for foreign medical graduates too.
Next question is, can MCH be pursued after DNB integrated course in the subject, since it is told that MCH builds up profile as a professor, and is it better for corporate jobs?
Okay, right. So ideally, nobody does that. Okay, when you do 6 years of neurosurgery, pediatric surgery, and plastic surgery, nobody would want to prepare for NEET super specialty and again do neurosurgery, plastic surgery, pediatric surgery. Okay, that's a very rare thing which people do. Instead, what people do is they finish this and they go to a government setup, or they go to some medical college where they can get hands-on. So that is why I said, when you do a 6-year course, choose a good hospital where you get a good cutting. Right, I'll give you an example. One of my friend who did MBBS in KEM, he was preparing for surgery, but his rank, he was getting the best college in MS General Surgery. But what he finally wanted was neurosurgery, so he took a 6-year DNB neurosurgery course in Narayana Ridyalaya in Bangalore. Right. So it is important that wherever these 6-year courses are there, you just call up and ask how you get enough cutting or not. What do they teach you? Is the academics good? And if it is good, then only opt for it. I wouldn't prefer any student doing 6-year course of super speciality and then going for MCH. So already the years of medical field education is 13 years. You're increasing it to 16 to 17. So you should be careful about it.
Right. It's actually very insightful. So actually, I also have a follow-up question to something you said earlier.
Yeah.
So if people it's better to pursue your DNB or an MD in the country in which you want to settle in, right?
Right.
So, but since there are changing
Right.
trends in medicine altogether, and the way we are approaching medicine, like so many surgical fields like cardiothoracic surgery, it is going, the preference is going down, because the job performed by them is now going towards interventional cardiologists. So since keeping a futuristic perspective, would it be better to get a postgraduate or a degree outside that trains you a little more advanced, and would that hold for a better we come back?
Outside means out of the country, or
Out of the country, out of the country.
Right. Okay. So I'll give you an example. Whether you do MD or DNB from any part of India, right? It's important that you get good training. Like,
Yes,
for
sir.
example, the college where I have done MD from, that is Mahatma Gandhi Mission Medical College in Aurangabad. I have got about, I think, 300 to 350 intubations to do during my 3 years, with about 100 to 150 central lines, 20 to 25 arterial lines, right? And so many procedures. Okay, so let me ask you one thing. Is the population more in India or population in US or UK? So where that, right. So if you make a blunder in US or in UK, would you be able to cover it up more, or would you be able to cover it up in India?
Hmm. Makes
Right.
sense.
So what I'm trying to say is that you get enough chances and you get enough exposure in a country like India. Why do you think US and UK are looking for Indian doctors? The
Hmm.
only reason being Indian doctors are very well experienced. Okay. And they have a very high exposure of handling all kinds of critical cases. So that is why Indian doctors are found to be more, experienced and exposed to different kinds of cases. Of course, going to US and going to UK and practicing has its own benefit. Let me tell you, in India, we don't follow any protocols which are written in the guidelines. Like if you have something like basic life support, the guidelines which say states according to AHA, American Heart Association, it is not followed in India. In India, one patient comes to the casualty, हाँ sugar check करो, हाँ BP check करो, saturation देखो, pulse rate देखो, हाँ चलो चढ़ जाओ, compression दो. This is how things work in India. But if you go to US or PLAB, even shifting a patient from the trolley to the bed, it's equal on the count of 1, 2, 3, and they count and they shift. This
Hmm.
is the kind of training you get in a country like US or UK. So both have its pros and cons. It all depends on what you want to attain in life or where you want to settle finally.
All right. Also, sir, there is some since now that next is in the picture, will there be like the people who appear for NEET, like the people who appeared this year and the year I think 2022 was the next one. So if they wish to reappear for NEET, would they be giving NEET or would they be giving next?
No, no, no. See, if you're coming to 2022, let me tell you the next NEET. I shouldn't use the word next only. The coming NEET will be within 6 months. Like it will be done within next April. So if you count the months and see, it's hardly 6 months. Okay. So those who are willing to take a drop, for them, only 6 months preparation you need to do to give a NEET. But the moment you think of preparing for 2023, what you're going to give is next, because government has decided that 2023 there will be
No,
next.
but the
The
who have
last year of
already
NEET.
appeared for NEET, do they, if
Huh.
they wish to reappear, do they reappear for NEET or like will
No,
NEET
no, no.
be
There's no
an
NEET. There
appearance?
is no NEET. You have to appear for next only.
So the current MPP, like current 2017 batch will be the last batch to appear for NEET, and after that
True.
there's no NEET. There's
True.
only they
Two.
have to, like if they wish to appear, they have to write for they have to appear for
Yes.
next.
Yes. Yes. Yes.
All right.
That's how it is.
We have another question here.
Yeah.
Can this be done? Qualified as an FMG, take the next exam, do the internship, and take PLAB. This way, PLAB will consider the internship as FY1.
See, I'll tell you what. So this is something which you need to ask who is a PLAB counselor, because this is not something which is my expertise. But one thing I'll tell you, PLAB can be taken after your internship also, right? So earlier, I think there was an eligibility criteria that you need to have 2 years of experience before giving PLAB or something like that. But I think right now it's not there like that. However, I'm not sure about it. So that is something which you need to find out from someone.
All right. We have another question. What would be better, giving MRCP after MBBS or giving MRCP after MD medicine?
Let me ask you a reverse question. What are the high chances clearing MRCP after MBBS or clearing MRCP after MD medicine? So it creates a big difference there. Let me tell you, after MD medicine, clearing MRCP is not a cakewalk. It's very difficult. So you can imagine after MBBS. But don't MRCP, I would say that people, let me tell you, MRCP is equal to MD medicine, the degree wise, but not equal to the experience you gain during those 3 years of MD medicine. Okay, now there are few small coaching sectors which have come up with state that after MBBS, they will ask you to join with them, right, for about 4 years. And part time, they will enroll you to some hospital, and part time, they will make you prepare for MRCP during Saturday and Sunday. I would recommend, please do not go for that, because see, some hospitals know they want something like goats, scapegoats who can just do their paperwork. This is what is going to be your thing, right? So you have to gain that level of experience to be able to clear the MRCP exam. It is not something like you see an MCQ or solve it. It is not like that. You need to have good clinical experience to clear MRCP. And MRCP is not just theory, right? You have practical exam. You have part one, part two, and you have something called as PACES. PACES is proper practical exam where you have something called as they will move you from station to station and ask you to do a practical exam. questions related to that. That nowadays, that trend has started in the MD medicine final exam, which is called as OSCE, Objective Structured Clinical Examination. So we were fortunate enough to give that kind of an exam that maybe would be beneficial for us to clear MRCP. So I would suggest plan to do MRCP after your MD medicine. It gives a big bonus.
So MRCP is basically it's an exam we have to prepare for, right?
Right. It's not a course. You have to clear an exam and you get a membership of the Royal College of Physicians, like FRCS. It's like FRCS. So MRCP is the with respect to the physician category.
So what would be the difference between MRCP and FRCP, or MRCS and FRCS?
Right. So the thing is, a fellowship, or what we call as FRCS or FRCP, is more of experience based. Let's say you clear MD medicine, you register yourself with the Royal College of Physicians. After a certain year of experience, they will see your profile and you have to apply for it, pay certain amount, and they give you the membership. That is how FRCS comes up. Okay, but MRCP is not like that. It's a proper membership which you need to give for exam. Another thing is FACP, Fellowship of American College of Physicians. Okay, so that is also done by many MD medicine physicians. What they do is you just have to go to the ACP website and you have a list of eligibility criteria. So you do the eligibility criteria, like 7 years of experience, then doing that many publications, being a member of the American College of Physicians for that many years, and they give you the fellowship. That's how FACP, FRCS, FRCP comes up.
So FRCS and FRCP are basically experience based, like from
not experience based. It's about the following the eligibility criteria according to the Royal College, and then they give you. It's like that, not only experience.
We have another question on that. Is clearing MRCS and pursuing FRCS a better option?
If you do MRCS, that itself is more than enough for you to be a renowned surgeon. If you do FRCS, you become a celebrity surgeon. I think I should say like that.
All right, makes sense. The chat box is open if anyone else wants to ask any questions. So there's also, while we have other questions coming in, I would like to raise this. So a lot of people, it is said that what would be the future of medicine, or like in surgery, like what changes are we looking at like 10 years down the line in the terms of the investigations and approaches and the treatments we're administering to patients, now that there's so much digital innovation and technology?
So being a physician, I shouldn't say this, only because if I say that this is what is going to happen in future, probably what I am doing right now will become a problem for me later. Okay, but still I'll tell you. See, what is happening is a person who has done MD medicine or MS general surgery follows the conventional aspect, and that is pursuing DM. Right. The moment MD medicine is done, the next day they think, "Arey baap re, abhi DM ka entrance dena hai," and the only thing they do is sit and study. My colleagues, we are 8 students. 6 of us are preparing for DM right now. Fortunately, they are not there in this meeting, so I can say. Okay, so 6 people are preparing for DM right now. Now it is their personal wish because they like a particular segment like cardiology, neurology, endocrinology, whatever. But for me, it is something like I cannot stick with one particular field like neuro or cardio. Every day I cannot see ECGs, and every day I cannot see MRIs. Okay, so you need to have a mix of everything. Like it's a personal choice. Okay, so that is the trend which is coming up. In India, if you go to UK or US, let me tell you, a patient has to go to their general practitioner or the family physician who they are assigned to. They will tell you whether you need to go to a subspecialist or not. But in India, it's not like that. हाँ, छाती दुख रहा है, ECG निकाल लेता हूँ, ECG cardiologist को ही दिखाएंगे, and they go to directly to cardiologist. This is how the section works in India, right? And the cardiologist sees the ECG and he says everything is normal. He'll do an echo, and if he is lucrative for money, he'll do an angiography also, and then he'll say everything is normal. You go back to your physician. So this is how the system works. Okay, so for an MD medicine, I would say staying in MD medicine is always more advantageous in future, because once you become a subspecialist like cardiologist or neurologist, let me tell you, those people keep on saying that boss to aap log ho, aapko hi bhejna hai patient hamare paas. Oh, this is how it works. Similarly, but MS general surgery works in a different way, right? A cardiothoracic surgeon or neurosurgeon directly deals with the patients they are referred to. Okay, let me tell you, for example, a neurosurgery patient deals with something like brain hematoma or IC bleed, intracranial bleed.
Yeah.
So these kind of patients also primarily don't go to general surgeon, they go to general physician.
Yeah.
Then general physician refers to neurologist, then neurologist decides whether a surgical intervention is required or not.
Yeah.
So just imagine the stages which a patient has to go through to reach their final doctor.
Right.
So
Right.
practically speaking, who gets the most patients? It's a physician.
Yeah.
But a field like gynecologist is the best. No tension at all. Nobody can practice their field. They cannot practice anybody's field. So this is
Yeah.
how the system works for a gynecologist. Similarly, for pediatrician, a physician will never touch pediatrician. Maybe 10 to 16 years of age, if they prescribe levocetirizine, they'll write 1 tablet bedtime. If it is a child of 12 years, half tablet bedtime.
Yes.
This
Yes.
is the maximum they can do. Okay, so that is how you decide. For, I would say, for physician, it's a good scope. For a general surgeon, I would prefer, if I was a general surgeon, I would say that preparing for MCH, going for super specialty would be a better option for me, like that.
Like after an MS in general surgery.
Yeah.
If someone who's going for an integrated DNB altogether, then they already qualify.
Best. If you get a very good hospital, great. Nothing better than that.
Yeah. Oh, that's great. I actually had something to say. I forgot. Meanwhile,
I'll just take the questions from your also.
Yeah. That's what. As an intern, I'm confused what I really like. Any tips to choose any particular clinical branch?
Okay, see, let me tell you. There are many students who belong to this category that they have been doing their MBBS and they are not able to arrive to a conclusion what they like. Okay,
Yes.
so for this, I would say that what you like reading or which particular subject you like reading is an important aspect. Okay, another thing is, do not decide on the base of your internship. Okay, during your internship, an MD medicine resident will make you do only clerical work, but that is not medicine. Similarly, a gynec resident will only show her tantrums on you. That does not show that gynec is bad. It all depends on what interest you like. Okay, so if you're not able to decide which clinical branch you like, the only thing which I would say is differentiate between whether you like a surgical branch or a medical related branch. Okay, if you like something like a medical related branch, then you can list the subjects which are there in medicine, maybe dermatology, psychiatry, general medicine, pulmonary medicine, like that, and so on and so forth. Among them, you can take opinions from people and then you can decide. Please do not decide on the basis of money, because a physician may not earn as much as a pharmacologist. So that's the big variation. So don't decide on the basis of money. It all depends on your skill. So once you make the broad differentiation between a medical branch and a surgical branch, then you can decide what is preferable for you. It is very less likely that once you like a medicine related branch, choosing between dermat or general medicine or pulmonary medicine, you will not get bored with either.
Yes.
Okay, so that is least likely. So that is how you can decide on what to get or what to try.
Awesome. So what is your take on virtual consultation?
Okay, so this is something which I don't like, but I have to do. It's like that. Okay, because when you do a virtual consultation, you're not using something which is commonly used today. That is stethoscope. The only thing you deal with is x-rays, lab reports, and that's how you decide. But what to do? That's the trend right now. So we have to practice with the trend, because patients like being at home and consulting doctors from home. So because they like that, we have to move ahead with that. It's like that.
Isn't virtual consultation going to be like the future?
Yes, it is. It is.
Consultations and so many more things.
Definitely. I agree to that. So you have to become a good marketing person too. That's what I'm trying. No.
Sir, actually with this also, there's another question. Are apps like Prep Ladder and Marrow sufficient for exams?
More than sufficient. For next, more than sufficient. Let me tell you, Prep Ladder, Marrow, DAMS, Bhatia, all of these, they work really hard to, build up that particular curriculum, that video lectures. What have I done? I've also prepared from that only. No, So when my time was there, probably there was only Marrow as online, rest were all face-to-face classes. So it depends on a personal choice, what you like more, you can opt for that. But definitely these are more than sufficient to clear the exam and do well.
Right. So what is the scope for anesthesia as a branch after MD?
Right. So this I just spoke earlier. Let me tell you, anesthesia is a very good branch. They are the backstage people, as I said earlier. When you're in the OT, the credit goes always to the surgeon. But let me tell you, an anesthetist works more than a surgeon. Because if the anesthetist keeps up the vitals of the patient, then only a surgeon can perform. But only when a surgeon comes out and tells the patient, "Haan, jaan bach gayi hai," the patient will only touch the feet of the surgeon, not the anesthetist. This is the big difference. But a self-satisfaction is always there with an anesthetist, and that gives them peace of mind when they return back home. Okay, that is one thing. Another thing is that once you do anesthesia, there are new prospects which have come up. One is going for critical care, right? So once anesthesia is done, you can go for practicing critical care by doing a fellowship like IDCCM, International Diploma of Critical Care Medicine, or there's another thing called as Fellowship in Critical Care Medicine, which is by the Maharashtra University of Health Sciences. And there are many other critical care fellowship offered by private universities, and so on and so forth. So anesthesia gives a primary base knowledge to help you practice critical care in future. Once you do critical care, you can go ahead to managing ICUs. And the moment you become successful in ICUs, your OPD gets built up. So this is how the entire system of anesthesia works if you direct yourself towards critical care. And coming to the next part, that is salary or the payment. An anesthetist, I would say, works on cut practice. Like if an anesthetist stays in Bombay, he will go for one surgery in Jaslok, then he will go for one surgery in Bombay Hospital, then he'll go for one surgery in Breach Candy. Throughout the day, he'll be roaming around hospitals and taking cuts from surgeons and participating in different OTs. This is how an anesthetist earns.
Before we continue, there's a feedback form in the chat box. I request everyone to fill it. Meanwhile, we can continue answering questions. Feel free to ask. As of now, I think it's been very enlightening till now also, because a lot of things are in the blue about the future, like people consider, and then they don't go through with it. So those doubts are, it's really nice to see all those being cleared up. Even as a final year student, I can say it's beneficial for me as well. So yeah.
Right. Next question. MS Gynac and MD Gynac, only surgical intervention difference. Right. That's true. There is a surgical intervention difference which happens there. But let me tell you, an MS Gynac is not someone who only practices operations or gynecological operations. They also run their work with OPD. And there's a big OP number who comes because that 9 months requires regular follow-up. Right. So that is something which you should know. But if you say which is better, that only a gynecologist can answer, because they would always say surgical is better because that's why they chose that field, because surgical plays a big role in OBGYN. So that is something which you should take an opinion from a gynecologist.
Agreed. Like inside the field, we probably know it better than anyone commenting from the outside.
That's true. That's true.
Another thing, like, so you mentioned about pediatrics and ophthalmology. So there would be some benefit, I think, like if someone opts for an ophthalmology or like pediatrics or ENT. So these are like end specialties. Like if you do an MD in them, so you're already a specialist, as compared to doing like a general medicine and general surgery.
But let me tell you, pediatric is not an end specialty anymore.
That would have diversified also.
Let me tell you, pediatrics, all my colleagues who are pediatricians, they are preparing with my colleagues for NEET super specialty. And they also have pediatric endocrine, pediatric hemat, pediatric gastroenterology, pediatric, so many things. Even I don't know the names. So it's like that. That's how it is. It is getting saturated day by day. And the worst part is many of them want endocrinology and gastroenterology, and there are very few seats. And finally, they settle for cardiology or neurology. And there are already many people in it. That's how it works. Yeah, so, I think there is just one more thing I need to tell is that if you choose a field like medicine or surgery for that matter, not everyone can stay in metropolitan cities. Okay, remember, if you need to practice like a general physician and you want to be successful, you have to catch an area which is just the beginning. Stay there, build up there for years together, and you become a renowned physician. This is how a physician system works, or for that matter, any OPD consultation. Of course, if you're something like a dermatologist, even a dermatologist right now, I'm telling you, hair transplant centers, there are so many.
Yes.
And there are so many cosmetology centers. There are so many facial aesthetic centers, so many. So it is all about how good you're in your skill.
Right. So building patient base, because in metro cities it's
True.
already established pretty
It's
much.
already established. True.
They have their favorite physicians to go to.
Yeah.
Makes sense. Let me see if there are any other questions.
I have one. Can I ask?
Yes, yes.
Yeah, Ishan.
Go ahead.
So as we know that India has this advantage of practical exposure and stuff, and me and my friends being medical students abroad, FMGs. So like, if I be brutally honest, in past 5 years we have seen like 6 patients only, which is pretty bad compared to India. So in conclusion, I'll say that we don't have practical exposure at all, which MBBS students get in India from the first years only. So like, so let's say COVID has started, I've been studying at home for like past year and a half, but not seen any patients at all, right? So now if I plan to give next and then I give my next one, marks came fine. But is that 1 year internship in India enough for me to pass next two? And what will be the impact, because I have so less practical exposure compared to everyone else? How would that
See,
impact?
let me tell you. See, the grass is always greener on the other side. That's a fact.
Yeah.
You always feel that, yeah, they are getting more exposure than me. Me sitting in MGM will always think that KEM people are getting more exposure than me. One sitting in KEM will always think that AIMS people are getting more exposure than them. This is how it is. But that is not the right way to think about it. I'll tell you, during my years of MBBS, I can just say the countable number of patients I've seen.
Mm-hmm.
Okay, because a person who is doing MBBS, first year goes completely in theory, right? Second year is just the beginning of clinical, where you just are about to learn your history taking. Third year goes in just, orienting yourself to medicine, surgery, and gynec, where you are just, I would say, you just know the bookish knowledge of how to take a history, but you don't know how to arrive to a diagnosis. By the time you come to final year, medicine, surgery, gynec, and pediatrics, there's so much to study that you can't concentrate on what clinical aspect it is. By seeing 5-6 more ulcers than what you have seen does not make them a better doctor. What makes them a better doctor is how they have arrived to a particular diagnosis, which no MBBS graduate can do at that level. Okay, so don't consider yourself inferior because you're an FMG. Right. The main training of clinical aspect only begins in your PG. Why do you think a doctor who has passed MBBS does not sit to practice? Because he himself does not have that confidence. And that's a fact. Even when I was an MBBS, I didn't even know anything apart from paracetamol. Let me tell you today that when I finished my MBBS, when my family members used to call me and ask me for medicines, I used to Google and see what is the brand name for these common medicines. Okay, so that is the situation. Now, if I say something like patient has somebody in my family has got cold cough, I will only say what I have taken. I will not say what I have given patients, because an MBBS ideally does not give anything to patients. An MBBS only takes history. Right. So that does not give you an edge over the others. Okay, the moment you do your post graduation, that only gives an edge. That does not make you inferior in clearing exams too. Okay, see, I'll tell you what, these coaching institutes, no, like Prep Ladder, Marrow, or DBMCI, or DAMS, all of these have set questions. And every year they are updating questions in such a way that makes a person's clinical knowledge strong. And they have so many good video lectures that helps you see the patient's diagnosis. For example, if you see a peritonsillar abscess, okay, they have so many good pictures and videos which actually help you see those kind of clinical cases, and that you won't see in a normal ward also these days. Right, so technology has started changing, and it has become so advanced that a person sitting at home can get as much clinical knowledge as much as he can, only till arriving to the diagnosis. So you don't need to worry that way, because every MBBS graduate is in the same boat. That's a fact.
Yeah, and in that way, Next is doing better because all anatomy, microbiome is all clinical based now from Next.
True,
Just a
that's
good
true.
thing.
Yeah.
And one more question I had. So suppose that I pass next one and I have a high rank, hopefully, and then I get my PG seat with the rank. And now 1 year internship, and because of something, I couldn't pass next two for some reason.
Hmm.
So because of my next one, I'm still eligible for my PG seat. So can I enter
See,
PG and give next two, or we have to wait?
I'll tell you. Next one, according to the rule right now, once you give your next one, the score is valid for 2 to 3 years.
Okay.
So that gives you a chance to clear your next two, another 1 or 2 attempts.
Yeah, 1 or 2 attempts, right? But like next two finished, I got my score that okay, I haven't passed. But from next 2 months, like my PG is starting. Can I enter my PG and after in between, can I give next two?
That kind of thing I don't think has come up, because next one and next two has to be cleared to be eligible to practice for post graduation.
Okay.
Okay, so that is compulsory. But trust me on one thing, that once you clear your next one, it won't be difficult to clear next two. I think they will see, the board will structure it in such a way that clearing next two won't be difficult, but scoring a good rank in next one will be difficult. This is how they are going to structure it, most likely. So that depends on them.
Next two is basically OSCE.
Next to
More likely.
next to is just like a practical exam that we give in just now during our final examination.
Who is this?
Yeah, that's Abhishek. Abhishek is
Okay.
my junior. He
All
he
right.
just gave his NEET PG right now. So
Mm.
yeah. So just a few minutes before, I told about a student who dropped about AIMS Pharmac and is preparing to get. So that is Abhishek.
Oh, nice.
Yeah. So he is the one who, went behind his field and did not think about college. So that's the good thing what he did.
That's amazing. We need the courage to actually drop a seat that they find that's really nice.
True. That's very true. That's very true.
There's another question. Is next one, is there going to be a separate paper for SMGs, or FMGs, or all will be the same?
All will be same. If it is called a common exam, that means it is same for all. Like, of course, it is not like all MCQ. See, I'll tell you one thing. If I'm going for a NEET exam, the person sitting next to me will not have the same questions, right? They have a question bank of about maybe 3,000 questions or something, and that questions will just pop up to you. So that is how it is. But the exam is common for all, and it's the same for all. So an FMG student will be sitting with an MBBS graduate in the same examination hall and giving next part one. So it's the same.
Right. Sir, now that we have a new MBBS curriculum in place, like I think 2019 batch, they are actually, their MBBS format has changed altogether. And these are the same people who, like, in a couple of years, they'd be giving the same with people who have dropped or something. They'll be giving the same exam with the people who are from the old curriculum of next. So, of MBBS, sorry. So, how is this going to impact the future?
See, let me tell you, the new curriculum which has come up, that is whether it is going to do benefit for the students or not, that only time will say. Because each student takes up the curriculum in a different way. Right.
Yes.
So I'll give you an example. The moment you finish your 12th standard, and the moment you stepped into your first year MBBS, the way we studied physics, chemistry, and biology is way different from what we are studying as anatomy, biochemistry, and this thing, physiology. Correct.
Definitely.
It's so different. So to get used to from 12th standard to a new way of adapting to new subjects was so different. Similarly, for them from 12th standard to jumping, which is a new curriculum, we don't know how they will respond or how they'll do well. That I think with the first or second batches only will be able to say. But anyhow, I don't believe that there will be a big difference because the content is finally the same. It's all about the approach. I think the curriculum right now does not focus much on medical legal ethics, does not focus on doctor-patient communication. I think these will be the major focus aspects in the coming curriculum.
Somewhere, sir, there is also an increased clinical exposure because we see our juniors, they get to shadow in OPDs and fill forms and things that we are not ever exposed to, because when like the old curriculum people, like our batch, so whenever we have an OPD day, that is the day they actually don't take us to OPD altogether. And otherwise, for the new batch people, it is more mandatory to actually go through all
You're
of these
telling me that if it
rotations.
is
So
mandatory, then only students will do. If it is not mandatory, students won't do. So that's what I said. It's a personal choice.
yeah, right. But
Nobody,
also,
let me tell you, let me tell you, nobody will ever stop a MBBS student from coming to the OPD or going to the OT. Nobody
Right.
will ever stop. So it's all about a personal thing.
Good.
Like that, to
Yeah.
every MBBS student has a logbook in internship. Tell me how much part of the logbook do you complete diligently? Hardly.
Right.
Yeah.
There's
So
another question here.
yeah.
How is forensic medicine as a field? And I think even I've heard this question from my friends, like the scope in India and abroad.
Okay. See, in case of forensic medicine, now every field has got teaching. So let's just leave that. Forensic medicine, definitely you can teach. Apart from that, a medical legal case is handled by a forensic medicine expert. Okay. It will be clubbing something which is called as law and medicine together. Like the way we have hospital administration and medicine together, like MBA. Similarly, you will have something like LLB in a medical format. So if you are interested in that kind of a thing, definitely you should go for it. Now, please don't come to salary point of view, because salary varies from person to person. There are many forensic medicine specialists who actually deal with high profile cases. Okay, when they deal with high profile cases, the stress is also much. At the same time, pay is also a lot. Okay, so it varies from person to person. At the same time, I know forensic medicine people who are practicing like physicians also. Okay, so it varies from person, but on broad, you have medical legal cases to handle, you have court cases to handle, you can do autopsies, and apart from that, you can go for teaching. And yeah, so these are the broad aspects which you can work as a forensic medicine specialist. Then don't go opt for something like that CID Dr. Salunke types. Okay, so that is the fake forensic medicine. That is not the usual thing, right?
Right. So, what is the scope of having like a teaching career alongside a clinical career in medicine? Like, if someone does like an MD or a DNB, so like, does professorship go on the same on the same path, or is there like something additional someone has to do?
I would say it's something additional which someone has to do, because what happens is when you start practicing, no, you tend to become uh, like sidelined towards a particular thing which is generating income for you. That is how it is practically. Okay, because if you have to teach, you have to join a medical college. If you have to join a medical college, that much time you have to put into medical college. Okay, so that much time you're sacrificing from your OPD and private practice. So that is why many doctors do not go for teaching. But there are doctors who opt only for teaching. They'll have a limited salary, they'll have limited income, but they enjoy that aspect of teaching students and learning and investing more towards academics. So it takes an extra effort to go from clinical and put some effort in academics. I would say it's like that. Okay, but again, it's a personal choice. Like for me, teaching was always a thing which I liked. So I have registered myself with a medical college here also. So it's like that.
So because this is something even I consider, because I really like to teach, but then again
Yeah.
I want to be very clinically like sound or like
But
practice.
let me tell you, a good teacher only happens when you're good clinically. It
Yeah.
never happens like you cannot teach if you're not clinically strong. Like you won't be successful.
True.
I'll give you an example. There's Dr. Archit Bolur. You might have heard of him. I think he's the new trend in the medical field. Okay, Dr.
I will check him out.
Oh, definitely you should. Dr. Archit Bolur is a general physician who works in Manipal, KMC Manipal. He
Okay.
has given so good books, like his books of, I think, Insider's Guide to Practical Medicine or something like that. Like that is such a good book. It gives you all aspects of, even you should read Ishan. Okay, like it is something which is extraordinary, and it gives you a perfect guidance how to approach a patient clinically, how to examine the patient with so many pictures. His theory books are good, and you should listen to his lectures too. Really amazing. So he is the new trend. So he is such a good teacher because he is very strong clinically, and he's very young. He's hardly 35, 36. So
Right.
yeah, so it all depends on how you develop your skill.
I think that's the opinion about Dr. Abbas Ali also in orthopedics.
Yeah,
right?
that's true. That's true. Definitely. So he is so successful because clinically he is very strong.
Having a strong clinical knowledge integrated with a skill to teach. Like a lot of people don't know
Perfect.
how to teach. That's
That's
also
true. That's
something
true.
that
That's true.
we
So
observe it a lot in
yeah,
medicine.
that's true.
So I think that's also there. If there are not any more questions, we can take a picture together of the session and then we can close it. So could you please stop sharing so we could have everyone on the screen?
Yeah, just a second now.
I request everyone to switch on their cameras so that we can have one picture for the session. Hoping others will also switch on their cameras and then we can take a picture.
I'll ask you one question after this picture.
Yes, yes. Ishan, Charvi, can you take screenshots? Mine, I'm getting the header cut a little.
Okay, 1 second. I need to see how to take screenshots in this. Wait. 1 second.
I have taken one.
Okay, 1 second.
Ishan has a new device, so he's struggling with that today.
I have to see. If anybody of you can take it, then please take it and send it to us if possible.
Yeah.
Okay.
I have taken a couple of screenshots.
Yeah, I think it's enough.
Right. Ishan, your question.
Yeah. So after passing MBBS, so when did you get the feeling that okay, I'm a doctor now? Like
I
when
think
did you
I
realize I'm a
got the
doctor?
feeling. I got the feeling after MD. After MBBS, I felt as though people are calling me doctors, but I still don't know.
Yeah. For me,
It's
I
a
just don't
common
know
feeling
if
which
that feeling come or not.
everyone gets.
Yeah.
Somewhere it's especially when you don't come from a medical background.
That's
you
true.
get out of MBBS, you are everything to the family.
That's true.
That
That's true. That's a common thing which everyone faces. But I'll tell you, after you finish your post graduation, no, it's a different thing altogether. You get that confidence. You get that confidence that yeah, you can call me for any case, I'll come. It's like that.
Yeah.
So it's another level. So you have to go for post graduation. After MBBS, do not just because once one attempt you can't crack, you won't be able to crack your PG or something like that. You should not be like yeah, I will go for MBA hospital administration, or I will go for MPH masters in public health, right? So these, if you have interest, you should go. Don't go because you didn't get PG. So this is something which everyone should know.
So to pursue a teaching career like alongside clinical, is there a specific degree or like anything other professorship you have to do, or is your
Nothing like that. After you finish your MD, whichever field you are in, after your MD, you just have to work 1 to 2 years like a senior resident. Like whatever you are during your MD is called junior resident 1, junior resident 2, junior resident 3 for first year, second year, third year.
Right.
After you pass out, you have to work like a senior resident for 1 to 2 years. Then you get promoted as assistant professor, and then you get promoted as associate professor, then professor. It's like that.
Yeah.
So every promotion depends on years of experience, depends on publications. So these are the two main things.
Right. For NEET PG or like NEET or even next, so India still does not have any CV trend, right? Like it's solely on the basis of your exam.
But even if you join after being an MBBS in any hospital, they will ask for CV only. They will not ask your NEET scorecard.
So basically, getting your rank is one thing, but getting a job really depends on the amount of exposure in your CV, right?
True. That is very true. Because in your CV, there are a lot of things. Like it is not just, if you categorize a CV, there are professional achievements, there are academic achievements, there are co-curricular activities, social activities undertaken, and final proficiency. These are all aspects of different CV. So you have to make sure that during your MBBS, you get your maximum exposure there. And whatever thing you do, you should learn to note it down in your CV, because that will help you in future in every aspect, everything you do.
Definitely. That's actually something to take note of, because we think about practicing in India, CV part just goes out of the windows. Like even if like people who are active in extracurriculars, for them, they're like, what is the use of extracurriculars?
But by the time they realize it, it is too late. Yeah, we should have done this during our time. That's what comes up.
Yeah. That's a good thing. So basically in any, yes. What?
I got to know right now that CV is required for India also. I just thought we don't need it.
Yeah, me too.
Don't think India so backward.
Yeah.
Not backward in general.
But
This is something no one talks.
Yeah.
I'm just kidding. Yeah, that's very true. CV and all is very important. Yeah.
Even after MBBS, अगर तुम कोई job join करने हैं आज के time में, तो you need a CV.
Yeah. And a lot of people are actually branching out of medicine and not going for a medical field. Like a lot administration or stuff like that.
That's true. That's
Um, had this session for 1.5 hours, so that's
Yeah, if
awesome.
any more questions, you can mail me or you can message me on my Instagram, Facebook, or yeah. So these are the two things you can do.
I think Charvi has a question.
Yeah, tell me.
Actually, I just wanted the country. And one of my family friends, they told me that even if you are a qualified dermat, the investment part becomes a headache for a lifetime, because every 3 months you have like a different update of a machine that comes up, and then you have to keep spending money, or you have to take a loan. So what is the state of getting a government job or a private job after you have done dermat?
What is the state
Or
of getting a government job or private job after doing a dermat?
yeah,
Right.
or is it
So
mainly dependent on your clinical, or your private practice in a clinic?
okay, see, I'll tell you what, any medical field for that matter, whether it is psychiatrist, whether it is dermatologist, whether it is physician, or anything for that matter, every step begins with working with someone, whether it is private or whether it is a medical college. The moment you practice there, the moment you establish there, patients get to know you. Okay, patients get to know you, people surrounding you gets to know you, and that is when you will open up a clinic. So it is stepwise. It is not like you can one day you pass out and you can immediately start a clinic. Of course you can, but the prime concern is that you need to get patients, which creates a name. Like I'll give you an example. If I'm a physician, so if I set up my own clinic right now, nobody will know me. But I have joined a place called as Craft Hospital, which is like world famous. Okay, in India, Craft Hospital is very well known. So if I set up a clinic maybe after 2 to 3 years and say that I'm a consultant working at Craft Hospital, that name is big. So that is how things work. Okay, it is not necessary that you need to start your own clinic in the beginning itself. So it goes in a stepwise way. Coming to the investment part, every field has its own investment. I'll tell you, if you start with a dentist, even if you start with a dermatologist, if you say about an orthopedic, if you say about a plastic surgeon, everybody have their tools. Okay, so investment is definitely big, but it is your personal choice whether you want to set up that or not. And usually, where investment is big, people tend to start their own when they achieve that level of money or they are eligible to take that level of loan. People don't start in the beginning itself. So usually they take a step like that.
Okay, thank you, sir.
Okay.
We have another question. How is the field of assisted reproductive technique in Gynac, and is some specialty required for the same?
So the hospital where I'm working right now, it's called Craft and AR Medical Center. This Craft is the most well-known place in India for known for infertility. Okay, so the doctors working over here are all MS Gynac, followed by fellowship in infertility, fellowship in reproductive medicine, and courses like that. And that is widespread all over India. Okay, so it is something which is coming up very nicely because India is moving towards more of a Western culture. And you know that in countries like US and UK, cases of infertility are huge. So if India is moving towards a Western culture, naturally infertility cases are going to increase. So ART is something which is a very upcoming field in Gynac. And after MS Gynac, majority of the gynecologists opt for fellowship in infertility. They do not just stay MS Gynac. So it's a very lucrative field. And best part is that fellowship lasts only for 1 or 2 years. That's a maximum. It's not like a 3-year DM course.
So what other fields are like actually something if we're looking at the future, that like psychiatry or ART, like she said, what else is coming up now like that? Because at this point, people should also be thinking about what is going to last. Someone who's going for a cardiothoracic surgery specialty right now might not have any scope in the future because their role is gradually diminishing in the medical practice altogether.
Right.
So what are the fields that are going like having like a demise situation, and
See,
what is coming up?
whatever field I tell you now, it is not like the next step. It is a final step. Like, for example, if a patient of cardiac arrest comes with, let's say, a heart block or something, the next step is doing an angiography and angioplasty. So a lucrative field is interventional cardiology. So that
Yeah.
is MBBS, MD medicine, DM cardiology, and DM cardiology in a hospital which has intervention.
Right.
Similarly, I'll tell you neurology. Okay, MBBS, MD medicine, DM neurology. Then there are now fields which have shown specialized in epilepsy, specialized in stroke, specialized in pediatric epilepsy. There are things like that. So every field is just getting deep and deep and deep because there's so much to study.
Right.
Okay, by the time we reach there, either our children will get married or we'll die. Okay, so that is the scenario right now. So the more you go deep, it never stops. It never ever stops. It just keeps continuing. So it's your decision where you want to stop. I stopped at MD medicine itself.
Right. Makes sense, because a lot of people, I mean, it's at the end of the day, it's about the patients we want to deal with. And
True.
like you said, general surgery is reduced to like the most basic of ulcers and doing, what are those, gallbladder.
True, that's true.
I know.
Now,
Right.
gallbladder is not done by
Positive way.
general surgeon. Gallbladder is done by laparoscopic surgeon.
Laparoscopy.
ERCP, MRCP, ERCP, and there's that MRCP thing, the investigation
Magnetic.
MRCP. Yeah,
Yes, yes.
magnetic resonance
Yes,
cholangiopancreatography. You should be, yeah. So everything has gone deep and deep.
That's what I think. Surgical field, somewhere they are going into an like an interventional medical
True,
fields
true, true.
instead of
That's
being
very
surgical
true.
fields altogether.
Yeah.
So somewhere I think, while considering like personally, I think that if I'm considering something in the future, I want to consider that something that won't die by the time I reach there. So
Yeah,
I think
that's true. That's true. But I'll tell you what, that's what I told earlier. Every branch is equally important. Okay. Everyone wants uh, a particular field. Now, let me tell you, I'll tell you the biggest difference. The moment you do something like a super specialty or go deep, no, that when you go deep, you are wanted in the metropolitan. But when you're broad, you are wanted in the rural or semi-rural. That's
right.
how it works. Like a person who is an average earning member in a family does not have the income to go on a regular follow up to a pediatric epilepsy specialist. He will go to an MD pediatrics or go to a pediatric neurologist maximum. So you
Right,
got my
right.
point. That is how it is. So the more you go deep, the less patients you get. That's how it works.
Agreed. Makes sense.
So in that
Any
is-
more questions?
in
Yeah,
that,
Ishan.
I feel that even in coming 5 years, psychiatry will boom because as
Definitely.
youngsters, we are like talking about mental health more often now.
Yes.
So
Yes. Yes.
I think
Very
society
true.
is more acceptable in
I
that.
think psychiatrists will play a big role. But you know what? The thing with psychiatry is that it does not follow the conventional way of achieving success. The
Mhm.
moment you're qualified as a psychiatrist, you have to take extra efforts, not just in getting patients or seeing patients. You have to go and speak among different communities. You have to go to small communities, small sectors, speak to them. Start from children to adults to grandparents. You have to go till that extent. Okay, so it's all about your interest. I'll tell you, the only thing I liked about psychiatry was going and talking to people. So that is something which I liked. But lifelong doing that, I don't know, I had so much patience or not, so I didn't do it. So it varies from person to person. But psychiatry is a very lucrative field. It's a very good field.
So, which fields offer the best work-life balance in terms of, again, I know there are personal factors to this, obviously,
Yeah.
but like the demand in your demand and emergencies in the hospital, where do we see more of them and where do we see less?
Okay, you want balance between work life or home life, or you want balance in your patient satisfaction?
Um,
That's the choice to make. Okay,
somewhere,
so let's say you want a balance between your home and work, then you have to limit yourself. You can limit yourself in every field. If you do MS orthopedics, you can limit yourself to just OP and stop doing surgeries. So that will make you balance. If you want to limit yourself to MD medicine, stop ICU, stop inpatient admissions, see only OPD. The best field where you can practice everything and at the same time balance is dermat. Do procedures, do OP, no emergencies, go home peacefully and sleep.
right?
But fields which ruin your home life is emergency medicine.
I mean, even
Because
surgery I've heard.
yeah, because you will have to come for night calls and everything, so that destroys your. But you know what, the doctors who take emergency medicine, for them It's like that is the thrill in their life. So they like doing that, so they'll continue to do that. It's like that.
It's actually, as you said, like we have to choose a field that you're really passionate about, that you
True,
like to.
true.
So
So that's why choose
that,
your branch over the college. It's always like that.
all right.
And so what if a person like me who sometimes thinks that I just love the adrenaline rush in emergency medicine, and then one day I think, no, I want to become a diabetologist, life will be easy, so no complications. It keeps swinging between both, like extremes. Then what should a person
Yeah. So
decide?
what you do, yeah. So what you do is once you finish your this thing MBBS, sit and practice in an emergency for 3 months. That will tell you whether you can lifelong do that or not.
Mhm. Yeah, makes sense.
Okay, 3 months when you practice one particular field. Okay, diabetology is not something which you can do right now because you need good knowledge for that, and you need to reach that level. But emergency medicine, definitely casualty, every MBBS doctor should handle. Okay, so if you like working in the casualty and you like being in the casualty 24/7, then go for it. See, remember, everything part of it everyone likes, but think of it doing lifelong daily. If you
Yeah.
can do that, then opt for that.
Also, like I think the experience as a doctor is very different from the experience as a student. Like I shadowed a doctor, and then the experience there was super. It was completely opposite from what we get in clinicals, even though we're dealing with patients every single day in both the aspects. So I think somewhere how your hospital, like the life in that field, is going to be very different. So that is something I think we can consider while making a decision. If there are any more questions.
I have one more. Can I
Yeah,
ask?
tell me.
Yeah. So, what do you see in future aspect? Only one more question. So, like as robotic surgery is emerging, which fields do you think their demands will reduce because of the new robotic thing? Because there are many articles based on like how robots will remove doctors and stuff. They can't remove, but in what way?
No. Wait, I think there's a misconception. Robotic surgery does not mean robots are doing the surgery.
A doctor needs to
Hmm.
Robotic
yeah.
surgery is the equipment which you're trained to use to do the surgery. Like, for example, an ENT surgeon who does head and neck surgery or a deep ear surgery have to use that kind level of equipments, okay, which are micro detailing, right? So when they use those level of equipments, that level of training is called as robotic surgery. And I think there are very few hospitals in India, I'm not aware which all do that, but usually people take that training abroad and come here. That's how it is. I'll tell you another field, bariatric surgery. So
Yeah.
many obesity patients go for operations. And there's a very famous bariatric surgeon in Mumbai, Mufadlal or Mufadwala or something like that. So he is so famous, and he has operated so many bariatric surgery cases. So usually what surgeons do is they have this thing that they do general surgery here. Then they go to some place in the entire world, learn a skill, come back here, import the instruments and start that here.
Yes. So
That is the trend which happens among surgeons and interventionals. So
that's how Calcutta also, like from Kolkata, that's how bariatric was introduced because the person went abroad, learned, and then he introduced it in Calcutta.
true. That's the
That's
thing.
how Ganga Ram liver surgery did. It was Dr. Samitra Rawat. I think he was the one who introduced robotic surgery for liver patients, and he got a Padma Shri also for that.
Right. I'll tell you.
So
Yeah, so that's how it is.
somewhere for these trainings these trainings would be courses that are outside of these MD, DNB, or like a
Yes.
DM, right?
Yeah.
So some for like a few years or 6 months or so. So you have to leave the practice here, you go there, you get trained, and you come back.
See,
Something
it's
of that.
not, don't think of it as leave the practice, because when you go there, you're training yourself in that field and you're seeing patients daily with respect to your particular intervention. So that makes you
Right.
a pioneer in that intervention. So you come back and practice only that throughout your life. Then you become an expert in it.
Right, that's good. Gangaram actually does robotic surgery. I've seen a robotic surgery. It's basically, I think the difference again, it's on the equipment. Like slowly the open surgeries are going down, laparoscopies are more preferred. Eventually laparoscopies are like robotics is going to take over that, because the view is 3D now, what we see on the screen. So somewhere I think all those, it's just the technology that is innovating, and what is going to come forward and last, what is there to last in the future.
True.
So I think that should bring us to an end to the session.
Yeah.
Thank you so much, sir, for being
problem.
so patient with so many doubts. And I'm sure the session has been super useful for so many people. The full recording will be on YouTube, Dr. Sarkar's channel, and even on Sir's channel. The links, as Sir has provided, you can always reach out to Sir on them, and we'll also forward it on the WhatsApp group. Yes, and I hope everyone had a great session. And
Yeah. Sir,
Right.
Kasturba,
yep,
that,
thank you so much for attending.
so that Kasturba
Yeah.
doctor's name, Dr. Anur who? That,
Dr. Archit Bolur.
Acha, Dr. Archit Bolu.
Yeah, Dr. Archit Bolur. Okay, if you have any doubts, you can mail me, message me,
Okay,
right?
sir.
Yeah.
Right.
Archit Bolur is very famous. Just Google him, you'll get him,
Then, okay, sir.
right? Okay.
Thank you so much, everyone, for attending. And on behalf of Doctors for a Cause, really grateful for everyone's presence. And we really hope this was a useful, beneficial session that cleared a lot of doubts. And thank you, sir, for taking out the time for this and being patient.
Yeah.
If you want, please fill the feedback form. If you want any more sessions like this or anything else that you would like to see more of us or from Sir also, we can definitely arrange that in the future. As of now, thank you so much for joining and hope you have a great day.
Thank you, sir. Bye bye.
Thank you. Bye.